Question 1. What is the most appropriate initial nursing action for a patient with suspected sepsis, showing a BP of 85/50 millimeter of mercury, HR 120 BPM, and a temperature of 39.2 degrees Celsius? A. Administer acetaminophen for fever. B. Call the physician after documenting findings. C. Begin fluid resuscitation per protocol. D. Place the patient in reverse Trendelenburg position. Answer. C. Begin fluid resuscitation per protocol. Question 2. Which patient should the nurse see first during morning rounds? A. A patient with mild abdominal pain awaiting culture results. B. A patient with a BP of 90/60 mmHg, HR 112 and chills. C. A patient with sepsis receiving 4 antibiotics with a temperature of 37.6 degrees Celsius. D. A patient with a history of UTI complaining of fatigue. Answer. B. A patient with a BP of 90/60 millimeter of mercury, HR 112 and chills. Question 3. Which task can the RN safely delegate to the unlicensed assistive personnel, UAP, when caring for a patient with sepsis? A. Administering 4 antibiotics. B. Monitoring urine output hourly. C. Assessing for changes in mental status. D. Evaluating fluid response to treatment. Answer. B. Monitoring urine output hourly. Question 4. A patient with sepsis is being transferred to ICU. Which action is the nurse's priority before transfer? A. Update the family. B. Discontinue the 4 fluids. C. Ensure airway and hemodynamic stability. D. Complete the discharge summary. Answer. C. Ensure airway and hemodynamic stability. Question 5. Which clinical sign most strongly indicates progression from sepsis to septic shock? A. Temperature of 38.5 degrees Celsius. B. Systolic BP less than 90 millimeters of mercury despite fluid resuscitation. C. Heart rate of 98 BPM. D. White blood cell count of 12,000/mm superscript 3. Answer. B. Systolic BP less than 90 millimeters of mercury despite fluid resuscitation. Question 6. A new graduate nurse is caring for a septic patient. Which action by the RN requires immediate correction? A. Starting antibiotics after obtaining cultures. B. Delaying fluid resuscitation to await orders. C. Monitoring urine output closely. D. Reporting decreased level of consciousness. Answer. B. Delaying fluid resuscitation to await orders. Question 7. Which of the following is an expected finding in early sepsis? A. Bradycardia. B. Hypothermia. C. Warm, flush skin. D. Severe hypotension. Answer. C. Warm, flush skin. Question 8. What is the nurse's priority action when a patient with sepsis develops confusion and restlessness? A. Document findings and continue monitoring. B. Notify the provider immediately. C. Encourage fluid intake orally. D. Place the patient in a quiet room to rest. Answer. B. Notify the provider immediately. Question 9. What is the most appropriate intervention to evaluate effectiveness of fluid resuscitation in sepsis? A. Assess skin color and temperature. B. Monitor blood glucose. C. Measure urine output hourly. D. Check pupillary response. Answer. C. Measure urine output hourly. Question 10. Which assessment finding requires immediate intervention in a patient with suspected sepsis? A. Blood glucose of 160 milligrams per deciliter. B. Respiratory rate of 28 breaths per minute. C. Capillary refill of 4 seconds. D. Oral temperature of 37.8 degrees Celsius. Answer. C. Capillary refill of 4 seconds. Question 11. A patient with sepsis is receiving norepinephrine. What is the nurse's priority assessment? A. Heart rate. B. Blood pressure. C. Peripheral pulses. D. Skin turgor. Answer: B. Blood pressure. Question 12. Which medication should the nurse anticipate administering first for a patient in septic shock? A. Vasopressin. B. Ceftriaxone. C. Dobutamine. D. Lorazepam. Answer: B. Ceftriaxone. Question 13. In reviewing lab results of a septic patient, which value is most concerning? A. Lactate 5.2 millimoles per liter. B. Hemoglobin 11G/DL. C. WBC 13, 500/mm superscript 3. D. Potassium 4.3 milliequivalent/L. Answer: A. Lactate 5.2 millimoles per liter. Question 14. Which of the following is a key component of the 1-hour sepsis bundle? A. Administer corticosteroids. B. Delay blood cultures until fever is confirmed. C. Measure lactate level. D. Obtain urinalysis. Answer: C. Measure lactate level. Question 15. The RN is supervising a float nurse caring for a septic patient. Which action by the float nurse warrants immediate intervention? A. Flushing a central line with saline. B. Hanging antibiotics without checking allergies. C. Starting oxygen via nasal cannula. D. Elevating head of the bed. Answer: B. Hanging antibiotics without checking allergies. Question 16. Which patient is at highest risk for developing sepsis? A. A 34-year-old with a sprained ankle. B. A 70-year-old with a Foley catheter and recent UTI. C. A 25-year-old postpartum patient without complications. D. A 52-year-old on antihypertensive medication. Answer: B. A 70-year-old with a Foley catheter and recent UTI. Question 17. What is the priority nursing diagnosis for a patient with sepsis? A. Risk for falls. B. Impaired skin integrity. C. Ineffective tissue perfusion. D. Activity intolerance. Answer: C. Ineffective tissue perfusion. Question 18. A nurse prepares to delegate tasks for a patient in early sepsis. Which task is appropriate for the LPN? A. Titrating vasopressors. B. Initiating fluid resuscitation. C. Administering scheduled subcutaneous heparin. D. Assessing for signs of end organ damage. Answer: C. Administering scheduled subcutaneous heparin. Question 19. Which finding indicates that the patient is responding well to sepsis treatment? A. MAP of 60 millimeters of mercury. B. Urine output of 35 milliliters per hour. C. Decreased level of consciousness. D. Increased serum lactate. Answer: B. Urine output of 35 milliliters per hour. Question 20. Which action should the nurse take first when a patient with sepsis reports shortness of breath and exhibits cyanosis? A. Apply supplemental oxygen. B. Notify respiratory therapy. C. Administer a bronchodilator. D. Elevate the foot of the bed. Answer: A. Apply supplemental oxygen. Question 21. A patient with sepsis is receiving fluid resuscitation. Which assessment finding indicates a need to slow the infusion? A. Crackles in bilateral lung bases. B. Heart rate of 102 BPM. C. Urine output of 30 milliliters per hour. D. MAP of 65 millimeters of mercury. Answer: A. Crackles in bilateral lung bases. Question 22. Which intervention is most important to reduce the risk of sepsis in a hospitalized patient with a central venous catheter? A. Administer antibiotics prophylactically. B. Change the catheter dressing daily. C. Maintain strict aseptic technique during care. D. Use only non-sterile gloves during dressing changes. Answer. C. Maintain strict aseptic technique during care. Question 23. Which vital sign change is most concerning in a patient receiving treatment for sepsis? A. Respiratory rate increases from 20 to 26. B. Pulse increases from 90 to 104. C. Blood pressure drops from 110/70 to 85/58. D. Temperature drops from 39.0 degrees Celsius to 37.8 degrees Celsius. Answer. C. Blood pressure drops from 110/70 to 85/58. Question 24. A nurse receives 4 patients. Which one should be assessed first? A. A patient with mild cellulitis and low-grade fever. B. A patient with pneumonia who is confused and hypotensive. C. A patient with resolved sepsis and stable vitals. D. A patient awaiting discharge after antibiotic therapy. Answer. B. A patient with pneumonia who is confused and hypotensive. Question 25. Which laboratory result is most critical to report to the provider for a patient with sepsis? A. WBC of 13,000/mm superscript 3. B. Hematocrit of 35%. C. Serum lactate of 4.8 millimoles per liter. D. Platelet count of 160,000/mm superscript 3. Answer. C. Serum lactate of 4.8 millimoles per liter. Question 26. A nurse is teaching a group about early sepsis symptoms. Which sign should be emphasized? A. Persistent hypotension. B. Mottled skin. C. Mental status changes. D. Profound bradycardia. Answer. C. Mental status changes. Question 27. Which action is inappropriate when drawing blood cultures for a patient with suspected sepsis? A. Clean the site with chlorhexidine. B. Draw cultures before starting antibiotics. C. Use the same site as the 4-line. D. Label samples at the bedside. Answer. C. Use the same site as the 4-line. Question 28. In the event of suspected sepsis, what is the correct order of priority nursing actions? A. Notify provider, start fluids, get cultures. B. Get cultures, start antibiotics, start fluids. C. Get cultures, start fluids, start antibiotics. D. Start antibiotics, get cultures, start fluids. Answer. C. Get cultures, start fluids, start antibiotics. Question 29. A patient in septic shock is on vasopressors. What assessment takes priority? A. Bowel sounds. B. Peripheral perfusion. C. Pupillary response. D. Pain level. Answer. B. Peripheral perfusion. Question 30. A nurse is preparing to transfer a septic patient to a higher level of care. What should be prioritized before transfer? A. Remove oxygen to avoid delays. B. Start enteral feedings. C. Ensure vasopressor infusion is running. D. Send all belongings with the family. Answer. C. Ensure vasopressor infusion is running. Question 31. Which medication would the nurse question in a patient with sepsis and renal failure? A. Vancomycin. B. Normal saline. C. Acetaminophen. D. Norepinephrine. Answer. A. Vancomycin. Question 32. What is the nurse's best response when a family asks why their septic loved one is on oxygen despite normal oxygen saturation? A. It helps reduce fever. B. Oxygen supports cellular metabolism during sepsis. C. It keeps the lungs inflated. D. It prevents the heart from working too hard. Answer. B. Oxygen supports cellular metabolism during sepsis. Question 33. Which clinical change would indicate worsening sepsis? A. Decreased urine output. B. Improved skin turgor. C. Increased alertness. D. Decreased respiratory rate. Answer: A. Decreased urine output. Question 34. The nurse evaluates a septic patient's response to antibiotics. Which finding indicates effectiveness? A. WBC rises from 11,000 to 16,000. B. Temperature increases from 38.2 degrees Celsius to 39.5 degrees Celsius. C. Blood pressure stabilizes at 100/70 mmHg. D. Mental status deteriorates. Answer: C. Blood pressure stabilizes at 100/70 mmHg. Question 35. What is the role of corticosteroids in treating septic shock? A. To reduce fever. B. To improve cardiac output directly. C. To support blood pressure when vasopressors fail. D. To increase oxygen saturation. Answer: C. To support blood pressure when vasopressors fail. Question 36. A nurse is precepting a student during care of a septic patient. Which action by the student requires intervention? A. Elevating the head of the bed 30 degrees. B. Flushing the central line using sterile technique. C. Discarding the first 5 milliliters of blood from a line draw. D. Administering a vasopressor through a peripheral 4. Answer: D. Administering a vasopressor through a peripheral 4. Question 37. A nurse notes cool extremities in a septic patient. What is the clinical significance? A. Normal recovery response. B. Sign of improved perfusion. C. Indication of worsening shock. D. Unrelated to sepsis status. Answer: C. Indication of worsening shock. Question 38. Which statement best explains why lactic acid is monitored in sepsis? A. It indicates liver function. B. It reflects kidney filtration. C. It measures tissue perfusion. D. It confirms infection source. Answer: C. It measures tissue perfusion. Question 39. Which patient assignment is safest for the LPN? A. Newly diagnosed septic shock patient. B. Stable patient recovering from sepsis on oral antibiotics. C. Patient receiving titrated norepinephrine. D. Septic patient with fluctuating mental status. Answer: B. Stable patient recovering from sepsis on oral antibiotics. Question 40. What is the most accurate method to assess fluid responsiveness in a septic patient? A. Capillary refill time. B. Serum creatinine. C. Passive leg raise test. D. Temperature trend. Answer: C. Passive leg raise test. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.